Order the Interim Joint Committee on Appropriations and Revenue, meeting number 5, Wednesday, October the 16th, 1 p.m. Eastern Time. We're in Annex Room 149. Please call the roll.
Senator Boswell. Senator Deneen. Senator Douglas.
Present.
Senator Funky Fromeyer. Senator Givens. Senator Mays Bledsoe. Senator Neal. Senator Nemes. Senator Webb. Representative Banta.
Present.
Representative Bentley. Representative Bowling.
Here.
Representative Bray.
Present.
Representative Brown.
Here.
Representative Dietz.
Here.
Representative Dossett.
Present.
Representative Flannery.
Here.
Representative Fleming. Representative Fraser Gordon.
Yes.
Representative Freeland.
Present.
Representative Fugit. Representative Gentry.
Here.
Representative Hart.
Here.
Representative Johnson.
Here.
Representative McCool. Representative McPherson.
Here.
Representative Palumbo.
Here.
Representative Raymond. Representative Riley. Representative Stevenson. Representative Upchurch.
Here.
Co-Chair McDaniel.
Here.
Chair Petrie.
Here.
Yeah.
We have quorum and we have minutes that have been disseminated. I'll entertain a motion to approve. Have
Second.
a motion to approve and a second. Have a second. All in favor, aye.
Aye.
All opposed, nay. Minutes are approved. Next up on the agenda, we have tax expenditure report update, about 15 minutes or so. I hope we hit on this with State Budget Director John Hicks. If you'll come on up to the table, please. Good to see you, and thank you for coming over. If you will, introduce yourself for the record, and I'll place you under oath.
Thank you, Mr. Chairman. I'm John Hicks, State Budget Director.
You raise your right hand. Swear or affirm to tell the truth, whole truth, and nothing but the truth.
Yes, I do.
Thank you very much. Thank you for coming over again. We had communicated with you about a report you had submitted, which is a normal on tax expenditure report that's been going on for years. We had some additional budget language this time, and I think in your correspondence on September 11th, you mentioned House Bill 8, Section 62, and it asked for some assistance on possible elimination of tax expenditures. I think we had identified 40 as a number. You had corresponded back and talked about how much of the $9 billion plus tax expenditure cost that we estimate, or you estimate, a large portion, probably around $5.5 billion or so, plus are some big ticket items of policy concerns that have normally not been looked at, and policy concerns would say, yeah, these are probably going to stay. So they've not really been tackled, and you went on to say that there were other states have looked at tax expenditures and set up a statutory mechanism to give direction, whether they do it, a subcommittee does it, or somebody else does it. And then you also indicated that there was hard to do anything under a 4-month time limit. Fair enough?
Yes, fair enough, Mr.
Anything
Chairman.
further?
Yeah, I'd like to, give you a little more background on this because it's a great topic. Since the late 1980s, the executive branch has put together a tax expenditure analysis
Mr. Hicks,
report.
if you will, make sure that microphone is close enough to you,
All
and
right.
that light
Is that
is
better?
really green. Yes, thank you very much.
All right. In fact, it was started under Governor Wilkinson in the Finance Administration Cabinet, and then about 12 years later, it was moved into the Office of State Budget Director, and that you all put provisions in most every budget bill since about 1992 to have a biennial report that identifies basically all of the different kind of tax credits, deductions, exemptions, preferences, et cetera, that are part of the tax code, and the task is for our office to estimate the revenue effects to the general fund and the road fund of each of those. And so it's there's all kinds of definitions of what a tax expenditure means, but you get the gist of that. One of the things I would notice that in 2017, the Volcker Alliance, which is an outside entity that kind of takes a look at public sector governments, they did a grade the states of budget processes for all 50 states. And on the issue of transparency, Kentucky got a B. We'll take a B. And they noted that our disclosure of tax expenditures followed a best practice. So I've talked to people who said that ours is at least a well-detailed report. There's 258 items in here in terms of what has been scored. As the chairman said, over about $9+ billion estimated in the current year. The top 10 items comprise 60% of that $9 billion. For example, the sales tax exemption for prescription medicine is $1 billion. The property tax exemption on the state, the old House Bill 44, is over almost $750 million. Sales tax exemption for food, $700 million. Employer contributions for health insurance, about $700 million. So pension plans and IRAs, about $550 million. So those are the big items, and the chairman kind of referenced that. In House Bill 8, there were new items added, and the chairman went over it. It was placed in the revenue bill, and it was something I'll say quite extraordinary, which is that we would identify up to 40 tax expenditures to be considered, to be ended, a first grouping immediately, another grouping 5 years from now. And in my letter back to the committee, I wanted to say that we've done some research on one. There are only a handful of states who attempt to do, on an ongoing basis, a review and analysis of every tax expenditure in their code. But about 2/3 of the states do one periodically for economic development incentive tax provisions. So that's the more common. And I wanted to identify the structures that those states take in order to get to this point. One of the first things that has to happen when you do an evaluation of a tax expenditure, just like when you're evaluating budgets, you want to know the purpose or policy reason for that tax expenditure. Then you want to determine a method for selecting a limited number of tax expenditures for review. For example, the states that do it on an ongoing basis, Washington does, let's do all of them over a 10-year period. Colorado does it over a 5-year period. Minnesota does it over a 10-year period. Just acknowledging that there's a whole lot in here and there's only so much you can do in a period of time. And another key feature about identifying the purpose is when you evaluate something, you've got to evaluate it against, well, what did you expect to happen? What was the standard of, we could come up with analysis, but so what? Is it working as a function of, well, what was it supposed to do in the first place? And oftentimes you'll see, you all pass preambles in various bills and everything, but a whole lot of the tax expenditures in here, didn't have in the bill that originated them the reason for it. Some of it's common sense, but some of it is not specified. In other cases, so these states try to establish a performance standard by which they evaluate the behavior of that. And they set standard time frames to periodically assess them over time, and they make recommendations and share a report. But one of the things I wanted to bring to your all's attention, to draw a conclusion about 40 tax expenditures, you probably have to look at X times 40, right? Because not every one would be something one analysis would consider to be, let's stop it, let's change it, or let's continue it. And so the effort of coming up with 40 really would involve looking at 100 or so tax expenditures in order to get to a 40. And we don't yet have a structure to do that yet. And so I wanted to make, the chairman ask for some recommendations about, okay, well, how do we get from here to there? And which is a good question. And my recommendation, I have several, which is some options, is to adopt, the most common structure that has happened in these states is they have, it's through a legislative entity. That's the most common example. There's a survey out there, but that the Pew Charitable Trust has done about the states that have done this and what their structures are. So about of the 34 states that do it in some form, about 20 of them have a legislative entity. And the next most is they have an independent outside entity with appointments made. Right? Think of the consensus forecasting group that we have for revenue estimating. Well, they have something, some states have that as well, to have kind of an independent objective analysis. And so my recommendation is for this General Assembly to adopt one of those two approaches, which is to create an entity whose purpose is to look at tax expenditures over so many years, do an analysis, do an evaluation, do a publication of that. In that regard, you want to provide some funding, because almost every one of these states who do it thoroughly and comprehensively, they bring in a consulting firm to help them do that, because the lift is so significant about that. Whether or not any review and evaluation divulges a clear response is maybe in the eye of the beholder, right? Is this worth continuing? Is it worth changing? Is it worth ending? And one illustration of a legislative entity has been expressed is, Representative Fleming has had several bills in the last 3 sessions that at least proposed a board made up of General Assembly members to do that. And I said, and some other states have identified a structure where they kind of identified an outside entity or appointees to do the job. So, Mr. Chairman, in closing, the executive branch is a willing participant in the effort, because it's a good government approach to re-examine over time what you've done. We do that every 2 years in a biennial budget, but on tax policy, it's common across jurisdictions, both locally and states, to not have as specified a process to go through that. And so, the information that is necessary to do our revenue estimating involves a great deal of effort by the economists on my staff, the Department of Revenue, the Tourism, Arts, and Humanities Heritage Cabinet, and the Economic Development Cabinet, because some of the information that is necessary to gather this is resident in those agencies. So, Mr. Chairman, I want to just come back to you and say, there's a goal here that is worthwhile about reviewing tax expenditures on a periodic basis, but wanted to, suggest to you, some ways that can get there in a feasible method, and one that is driven by transparency and good data and information.
Very good. I appreciate it. So I want to keep this time tight if we can. Your office conducts the every 2-year report review of tax expenditures, right?
Yeah, and now annually, as per House Bill 8.
And I'm trying to ask this as neutrally as I can. Is your office capable of conducting an analysis if you were given principles and measurements by which to evaluate the ROI of each tax expenditure? Do you have the capacity to do that within your office, or no, we would have to get an outside agent to do it?
No, we would have to get an outside consulting firm to help us do that, for
Even
sure.
if we only asked for 5 to be identified in an annual period?
I think we would want to get I would say, if it's a small number, just for example, I would want to get some outside expertise on the methodology. I've looked at these other states who have prepared these things. It's fairly significant in terms of the level of effort.
And I agree with that. And Representative Fleming and I think, Representative Fleming, we've been looking at this, you and I, since 17 or 18. Did some deep dives. Years ago. Yes, it is complex, and we're trying to figure out some way to get started. This will start the conversation, and I'm trying to narrow down whether or not this is something that could be performed within your office. A limited number, I'm hearing maybe so.
Yeah, maybe so. One of the things I think that's real important, Mr. Chairman, is what do we pick to look at?
True. What kind of time frame would an annual? I'm not asking for a commitment. I'm asking for thoughts. 5 annually identified, analyzed, as long as you know what you're analyzing it for? Is that very reasonable?
I think that's a reasonable, yes.
Is 10 too many in a year?
I would say it depends.
Depends on the
right?
factors.
Because you get into corporate income tax and some of those elements. I know your committee staff administrator knows, who's probably involved in developing some of these first reports years ago. But yeah, I think that's real key is the selection of what to examine. Is probably one of the most important elements.
Very good. And on that point, and I appreciate your last paragraph in the letter, in an attempt to identify a few expenditures the GA may consider in having an analysis performed, you've got some suggested areas You had suggested potential areas of consideration: individual income tax deduction for gambling losses, sales tax exemption for lodgings of 30 days or more, property tax expenditure for non-commercial aircraft, and property tax exemption for federally documented vessels. What I'm interested in is, as to those, what factors or principles helped you identify those?
Oh, we were going through that five-page listing in here that shows the revenue estimates and trying to, I'll say, didn't want to pick too many winners and losers in this communication. And so trying to identify just what off the cuff might seem to, I'll say sometimes, my next door neighbor who say, well, what are we doing that for, right? As opposed to sales tax exemption on groceries, right?
Sure.
That was, so it was just kind of a review and a selection of things that might be on the margin and might have, I'll say the most limited number of beneficiaries.
So the ROI might be small
yeah.
impact?
Yeah, in those cases, no question, they would be small, yeah.
Okay. Any other factors used to determine that list?
No, not really.
Because this kind of helps inform of what legislation might take place
Sure.
or requests be made in the future.
Yeah.
If you can provide a principle or a factor that you think, as OSBD director, this is important to look at and a good factor to measure by. That's what I'm after.
Yeah, and I think another element to consider is age. How long has it been in place, and has behavior, whether it's the economy, whether it's business behavior, has that changed? That really, that was not what we meant 20 years ago, because the world has changed now. I think that's another prospective kind of idea to look at.
Very good. Last thing I think from me is this. I'm just asking. I know we had 40. It's a number. You might be able to get 5 in a year. You've got 4 listed. Have y'all performed any kind of analysis on these 4s for 4 areas of suggested consideration?
No, none yet.
Are you able to, willing to make that 4 of the 40?
Willing. Yeah, but the ability I mentioned is where we would want some help. Even if we were to pick some small and easy ones, precedent matters, right? And so you want to establish a process with a good analytical process. Right. And I'll just say, we haven't done that before, right? So I kind of admit what I haven't done before and what I don't know, and I would want to have some folks who've done this in other state jurisdictions to give us some advice.
Fair enough. That's why I'm asking, is because you've got 4 listed. We thought 5 in a year is doable within your office, and that's why I'm like, could you perform the analysis that you started by suggesting these 4?
Oh, we could.
Willing to, able to?
Willing to, and the ability to is what I would like to get some helpful expertise, because the process you would go through for a small one is likely the process you'd go through for a big one.
Okay, so I want to make sure, and I'm not trying to box you in, I'm trying to make sure I understand. May not be able to handle 5 internally, at least up front.
Right.
Would need external help.
Yes.
That's what I need to know.
All right.
Anybody got any questions? Representative Fleming.
Thank you, Mr. Chairman. I'll be quick, given your statement in terms of keeping it tight. Ms. Hayes did a wonderful job back in 2017, 2018, and laid out a very good format that I worked with her and looking at the tax expenditures. And I appreciate your comment, because that has been put forth on a couple of occasions. But I think the time is right now. We need to start peeling that back as much as we can. There are some low-hanging fruit. There's a middle of the road, and then there's untouchables that I call, which you've already pointed out. But I think going through and maybe talking with the staff and what we went through and the process could help that out significantly, to look at what we can do to see what's politically sensitive or insensitive. What is the ROI? What's the impact? You have to look at all those different factors which you pointed out, and I do appreciate you taking on the effort to look at and trying to find what we can do in order to make things better for us as we continue on to look at driving the personal income tax down to 0. But this is something that's been long overdue. There's a lot of statutes have not been looked at in years, and looking at historically, some things are just cherry picked and done for who or what. So anyway, but I just want to appreciate your effort in going through this process, and I stand available to help you out, and I'll be more happy. I'm sure Ms. Hayes will be happy to help out as well. She's been very, very helpful in that process in the past. Thank you, Mr. Chairman.
Anyone else? Saying none. Thank you very much, Director.
Thank you, Mr. Chairman.
And I look forward to talking to you further on this, and Representative Fleming. Next up, we have item number 4 on the agenda, current process for position compression study. Secretary Bailey, Commissioner Caldwell, General Counsel Holbrook. Very good. And when y'all are ready, just introduce yourselves for the record, please. And if you're going to testify or present information, then I'll put you under oath afterwards.
Okay, great. Good afternoon. I am Mary Elizabeth Bailey, Secretary of the Personnel Cabinet.
Rosemary Holbrook, I'm General Counsel of the Personnel Cabinet.
Good afternoon. My name is Jamie Caldwell. I'm the Commissioner of our Department of Human Resource Administration at the Personnel Cabinet.
Very good. Thank y'all for coming in today. If you'll raise your right hands. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Yes.
Thank y'all very much. We have current process for position compression study. I think anybody that's been around for a year or two or more understands that over a period of time we've had compression of pay in state government for employees. And we had language and request about how do we get to the issue of compression study. RFP requests to see if someone outside can help identify root causes of the compression over time, identify the causes, and analytically say, okay, what were the effects of those causes, and how do we craft a solution that hits the root causes. And I understand from your response to our correspondence that's been tried twice, same if the RFP process, 2 RFP responses, but from the same entity.
Correct.
Each time reviewed and scored as insufficient, will not do what is necessary. Fair
Correct.
enough?
That is correct.
And then in the letter memo dated September 26, 2024, we had corresponded with you. You responded on October the 8th. I think everybody has this in the packet. There were certain things that were identified as root causes. We've got no increment over time in how Personnel Cabinet responds to that in order to deal with maintaining employees. Regulations are cited where there may have been certain tools used to address that lack of increment over time. There had been a standing, we'll stop there for a moment. Some of those tools have been set aside by regulation.
That is correct.
Some remain in place. And then there has been a proposal about how to deal with compression issue, which is referenced in paragraph 11, 1% bump increase for 24 to 83 months of continuous service, 3% for 84 to 119, 5% to 120 to 155 months, 7% for 156 months or more of continued service. Fair enough?
That is correct.
What I'm after is, I think there was also a $90 million expected cost price tag associated with that particular set of recommendations.
Correct.
Okay. $90 million is a hard price tag, and compression is an even more difficult issue.
It is.
Wanted to make sure that whatever step we take has the most optimal chance of succeeding in addressing and alleviating the compression issue. What I'm looking for is what kind of data analysis do we have on the 1357? Like there's been a payroll modeling if this is done. What's the underlying basis for the recommendation itself?
Well, we believe that a tiered approach by an employee's months of service is the best way to address this, to try to capture those years that were missed from the annual increment. And we wanted to do the tiered approach to try to spread out employees so that, right now, and I know you all are hearing, because we are hearing, and we are very well, that new employees are being hired at the same rate as our senior level employees, and we understand that, and that therein lies compression. And if we are able to do a percentage-based increase based upon their months of service and try to spread each one out, then we believe that will we'll have measures to be able to address compression.
Got it, and I understand that being the recommendation, but I'm looking for what underlies the recommendation. So was there a payroll modeling that you did? If we do 1, 3, 5, and 7 on this recommendation, this is how it ripple effects through our payroll? Okay, is that what was done?
Yes.
Okay, can you supply that to us?
At that time, based upon at that time?
So the recommendation has a little length to it. So if you had if you had an underlying analytics at that point, yes.
Okay.
Have you done one updated since then?
We have not.
Okay. Do you think it would be advisable to do one or not? Updated.
Yes.
Okay. Given that there have been changes in schedules and
Yes,
pay.
yes. And you have to understand, that was done at the time that we were in the midst of the complete job review, and it was before the changes in the regulation for the resign reinstate. So I do believe that we need to do another analysis on that. Maybe the recommendation at that point on the range or percentages, we might recommend something different, to the Office of the State Budget Director and the Governor's Office, for consideration. But as of right now, the percentages and the months of service is, recommended was per the time that we ran it.
Very good. Will you supply that analytic that underlies that recommendation to us so we can see the payroll run back when the recommendation was made?
Yes.
Okay, good.
Yes, I believe so.
And then how long would it take you to, I'm just asking, how long would it take you to perform a new payroll run, an analysis to go, this is how it would ripple through? How long would it take to do a new analysis, update that analysis? Ballpark.
I was going to say about a month. I wanted to make sure that if there's 2 offices involved, so I know how long it takes, my team. So I wanted to consider the
maybe a
State
month,
Budget
30,
Director.
30 60 days might
Yes.
be a reasonable
Yes, absolutely.
expectation. Okay. I hope y'all go ahead and I can't require it, but I'm just going to ask. I hope you do, because I think the updated analysis will be extraordinarily helpful. What tools remain in regulation or with personnel generally to adjust pay? Some have been culled already, so I know we've got ACE awards out there, we've got resign and rehire. So what things are left?
Yeah. that are not seen. Right now, agencies have the ability to reclass an employee up to the midpoint of the grade. And they also have the ability to promote up to the midpoint of the grade. Agencies still have the ability to appoint up to the midpoint of the grade. And then you have the discretionary increases with the ACE and the ERA. We also have locality premiums. We have several premiums, locality being the one that, obviously is the biggest differential.
Do you have anything that could help us understand the relative impact of each one of those? Like ACE awards are used about this much, localities used this much, and like which one is more prominent than the other? Is that possible?
Yes.
Can you get that to us, will you please?
Yes.
Wonderful. Senator Boswell.
Thank you, Mr. Chairman. I just want to ask you about new hires.
Yes.
What I've seen with this compression, and I get a lot of calls and a lot of emails about this, and I can see it's a serious problem. So what are you doing as far as new hires? Are you offering any incentives for them to stay? For an example, what I've seen is maybe some of these job classifications where somebody with a job entry was 35,000, we've raised it to 50. It seems like if you consider maybe you should try to get them to start at 40. If they stay a year, give them to 42, and then gradually get them up to this 50,000. What I've seen is this huge bump, and then it solves compression problems for existing employees. So, have you used any tools like that to try to? And what are you using to try to retain these people once you start them at this high rate? Where are you going to go from there?
I understand. We did a comprehensive review of our job classification system and our job classes, which we have over 1,100, as the chairman knows, that this extensive work that was performed. And the grades that were determined, that determines the salary ranges for each job, was based upon market analysis. It was based upon just our point factoring methodology. The salaries that our agencies are hiring at for their individual positions or job classifications are based upon, the need and the rate in that area for those specific jobs. So to lower that would be a negative impact in that, that would not be the rate that we would need in order to obtain that individual or to fill that position. So I feel confident where we are with our classification system. Our salary schedule has also been raised 3 times now, and so we this last time I'm very pleased to say that. Once the governor updated this last salary schedule, that we had only 79 positions that were below the new entry rates, which is fantastic. And so we are making great strides in our recruitment efforts. But to also answer your point, that as far as what are we doing for future to increase employee salaries, that was the intention, of the annual increase to keep up with inflation and to ensure employees received an increase as they were here and they, were loyal public servants. Now, in addition to that, how they perform in their job, there's promotional opportunities, there's reclassification opportunities. As the chairman pointed out, we have discretionary awards that agencies give based upon either project-based or just they are an excellent employee and have performed their work very well, that we can reward those employees. So we do have avenues, but that across-the-board annual increase is very important to the base.
Thank you. I just want to say, in the private sector, a lot of times when new employees are hired, their salaries are based on staying, anymore because employees bounce around a lot. And I think more consideration should be given when there's people that are hired in that they will be able to achieve a certain level once they stick with their job performance after a couple of years. So that's my only point. Thank you.
Thank you. We'll take that under consideration. Appreciate it.
Chairman McDaniel.
Thank you, Mr. Chairman. Madam Secretary,
Yes.
good to see you again.
You as well, sir. Thank you.
Just to be clear, the salary schedule that was put into place as a result of the increases in funding that we made,
Yes.
that applies to everyone existing in state government right now, correct?
Correct.
It's not just new hires coming in. Everyone should.
Oh, yes, absolutely.
across the
Absolutely.
board with it.
Everyone, by regulation, everyone is required to make at least the minimum of the grade and the salary. And then those that are 5%, maybe that are not 5% above that new entry level rate is raised to that 5% above. That way, new hires, when they come off probation, they are not making more.
Gotcha.
Yes.
Thank you very much.
You're welcome.
Anyone else? All right, I want to say this really quickly. One, I appreciate you responding to us.
Yes.
2, I appreciate you coming in today. 3, I think in the correspondence to us, if you look at 9, 10, and 11, that's the data-driven part. That's what we're talking about today. We're just trying to better understand so they've got some degree of confidence when we take action of, okay, this is likely to have a majority good effect.
Right.
And lastly, I want to say this. You have, in my estimation, one of the tougher, if not toughest jobs around.
Thank you.
The whole
Agree.
the whole cabinet does. How many employees do you deal with?
We have 30,000 employees, and we handle payroll for 42,000 because, of course, we have the legislative branch, and then AOC, and then we have 22 county offices as well. So for 30,000, we have 150 employees.
Yeah.
So
And we also administer the health plan.
yes, for 290,000 members.
There's a ton of people.
Yes.
There's a ton of special circumstances, a ton of everything moving all the time, and whatever you just got finished doing is ready to be updated already.
It is. That's another thing I was going to say. Whatever we present, remember, tomorrow it'll be completely different because, it's a big workforce. State government is a complex animal per se, beast, because so many different agencies are performing so many different services, and between epidemiologists to a highway worker, and so it's hard.
We've had difficulties on some of those issues. I like to think we've made some incremental progress.
We have.
And the thing about it is there's going to be more to go. So getting to the next part of this, unless someone's got something else, we've got 3 or 4 people, 5 people, I think, that have asked to come in. We've got to keep it tight on time, but asked to come in, let them present what information they deem relevant, pertinent, within time constraints. If there's something you need to respond to or clarify, I will give you the opportunity to do that as long as we can keep it tight on time, okay?
Okay. I did want to make one more comment, if I may. Some really good news, though. Over the past 2 years, with the efforts by the General Assembly, with the annual increase and the governor raising the salary schedule, the work that we've done on the classification system and the work by agencies on recruitment and everything, we have been able to increase employment by 2,500 employees, and we have reduced turnover from 22% to 14%, so we are very proud of that. And we have finally been able to, I believe, stabilize state government.
And to put that in context real quick on the stabilization, I think you had included in your letter from October 8 letter between 2002 and 2022, we saw a 48% decline in state government staffing. Is that right?
That is correct.
Okay. So numbers being added on, but there was a large dip beforehand.
There was.
Very good. All right. If you will let a few more people come up to the table. Thank y'all very much.
Thank you.
And I believe we may have Terry Ratcliffe in the room. Terry No, Heather Collins, Renee Yates, and Amanda Nichols. Stand or pull another chair up or whatever works. There are some chairs on that first row if you want to pull one or more of those up, please. Hello. What we're going to do very quickly, we've still got to keep everything on the record. We've got tight time, so if you were thinking 5 minutes, I'm thinking 5 seconds, so it's going to be tight, okay? But make sure that, if you will, each of you introduce yourselves for the record. There are only 3 microphones and 5 of you, so hunt one down and make sure we get your name on the record, please.
Taffy Ratcliffe. Renee Yates.
Heather Collins.
Terry No. Amanda Nichols.
Very good. Thank y'all very much. If each of you will raise your right hands, do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
Yeah. I just.
Thank you very much. And so you heard what we're talking about, personnel adjustments being made over time. I don't need you to give us a recommendation on how to fix the entire problem, but I want to make sure I put 3, 4, 5 faces and 3 or 4, 5 examples to this is kind of what we're talking about. These are the issues we're trying to get to. Are all of you from the same division of government, state government?
4 of it. Oh, yes.
Okay. Yes. All right. Just want to make sure. So our sample may not be the broadest in the world, but if each one of you will take just a few moments and relate what you think is most important.
Mr. Chairman,
the committee members understand.
Mr. Chairman, before they begin, may I ask, I'm over here, may I ask, what's the rush?
We have an hour and a half to 2 hours, and we have more items on the agenda, and if I have to, we'll come back to it. I'm trying to keep us on track with the other items we have agended.
Is there something scheduled in this room afterward?
I don't know, but they really get hateful with us. If we go over 2 hours, I'll run the clock.
Let's test them.
Well, we will run the clock as best we can. Got them, and I don't want to rush them to cut off the testimony, but I want to make sure we understand we are under time constraints. Thank you. Go ahead.
Okay. Like I said, my name's Taffy Ratcliffe. With the Carter County office.
Make sure that if you will, make sure your light is on and that microphone is close enough, please.
Okay, sorry. We do have data. We can email that to the staff. I only had 10 copies. I did not realize there would be so many.
You're fine. That was brought to my attention beforehand, and,
yes.
And I've already said, I think we've got somebody that's going to make contact with you, and then we'll
yes.
make sure it gets to Ms. Hayes, and then it'll get disseminated to everybody yes. In the committee.
Thank you.
All right, thank you.
So first, thank you all for inviting us. We really appreciate that. I had a speech here, and I can do that, but I do want to respond to some of the things that the Personnel Cabinet testified to. So our mission at DCBS is to build an effective and efficient system of care for the citizens of Kentucky. And a large part of our vision is to provide the highest quality of service to the vulnerable of Kentucky. And in a prior meeting, Representative Petrie, you did state and ask what the purpose of state government is. And you said that was to render services of Kentuckians effective, efficiently, and meaningfully. And we cannot do that without good state employees, and we cannot have good employees without good compensation. In 2021, the committee did discuss with the Personnel Cabinet the issue, and unfortunately, we're still here today with the same issue. Deadlines were missed, incorrect reports were submitted, and now another report that you guys had asked that was due for December was not submitted. The Personnel Cabinet has made suggestions regarding the compression issues, offering solutions about the annual schedules, salary schedules. While we do agree that this will help, doesn't address the current issues. And also, it doesn't address the long-term issues. The percentages would be great. However, those will not help current. In a memo that was dated August 14th, the Personnel Cabinet stated new employees would be brought up to new minimum. However, there was an email that was sent out to us that said all appoint and promotional actions moving forward will bring the new ones to 95%, and then after probation, they would be brought to 5%, or they would be at the midpoint. So it did not say anything about tenured workers. Our tenured workers were not at midpoint. So the increase of percentages that they're talking about, if we don't get to the midpoint where the new ones are, those percentages are not going to help the tenured workers. In November of 2023, the meeting, it was commented on by a committee member. I don't remember which one, but she said that there was an issue with long-term employees in the same job classification making less than someone coming in new. That is exactly true. You will see in the packets here that issue that we have. Continuing with these types of decisions that the Personnel Cabinet is doing, it will cause many ripple effects with the agency. This can and will create serious morale problems. Who wants to welcome a new hire to the team when they know they're already making more than them? A supervisor, who wants to supervise an employee that's making more than them? Most staff have expressed feeling disrespected and disgruntled. It's human nature for our employees to feel this way, and rightfully so. This can lead to hostile work environments, hence causing more personnel issues or causing the employees to just quit. According to a Pew Research survey, employees who quit their job in the past year reported feeling disrespected as a leading reason. But most of all, this will impact our citizens that we serve. How are we able to produce good casework if we don't have tenured staff? This will result in families losing out on much needed and timely benefits they are entitled to and rely on.
Very good.
My name is Terry No, and I have 31 years of service with the Division of Family Support. So I've lived through all of those years when we didn't get any raises or anything, and we were even furloughed. So we're just now starting to get caught up just a little bit. So we're very grateful for all of the entry-level raises for the entry employees. No one begrudges the newly hired or the newly promoted employees for those raises. They were and are desperately needed for us to attract quality employees. However, this has had the opposite effect on our experienced employees. The incremental raises we have received over the past several years have helped, but we were suffering from a hemorrhage of employees before that, and we're just starting to finally try to catch up. But each time they raise those entry levels wages, it just makes the wage compression and compaction worse. For example, I said I've 31 years. My current job, I'm a case manager specialist 2, which is a grade 15. My salary is $60,955.68, and that includes the 3% raise that we got in July of 2024. Under the most recent salary schedule that came out September 16th, a newly promoted Case Manager Specialist 2 would make 95% of midpoint, which is $65,924.88. After 6 months, they would get a 5% raise, which would bring them to the midpoint of $69,221.28. This is an employee who has no experience in their current role. Therefore, the experienced employee, like me, will be responsible for mentoring and training the newly promoted employee, but that person will be making significantly more money. To say this is disheartening and discouraging is an understatement. We have gotten comments on we have a Family Support United Facebook group that has over 1,000 members on it within our division. They've messaged us saying that they're mad, they're sad, they're ready to quit, and they're looking for a new job that pays them what they deserve. We've used all the avenues available to us as employees to try to address our concerns. We've discussed them in our local staff meetings, in our CQIs, and in the commissioners' chats, but here we are. The wage compression is causing morale issues, which continues to cause problems with employee satisfaction, which is increasing turnover. People are trying to wait it out, hoping for some kind of resolution, and that's why we're here. Our jobs are hard on a good day. Citizens do not contact us when things are going well. They call us when they've lost their job, lost their health insurance, or their income just isn't enough to pay their bills and buy food and other necessities. They contact us when that loved one needs to go in a nursing facility and they don't know how they're going to pay for it. A lot of times when they call us, they're hurt, they're angry, they're discouraged, and they take it out on us. We see them when they are at their most vulnerable, but our calling is to help those in need, and we do our best to help them make the best of that bad situation and give them hope when they're having trouble finding any. As we've said, wage compression has been studied, and there's been recommendations made, but unfortunately they haven't been followed. We still have employees that have not been reclassified with the last salary adjustment in 2023. So some of those employees are missing out on $6,000 or $8,000 a year already. So we're looking for a short-term fix to address the current compaction and compression. ERA and ACE awards are subjective, and therefore they're just not enough because that's not something every employee is going to be able to get. We also are looking for a long-term solution because this will not improve unless there is a commitment to something of an ongoing yearly increment and other salary adjustments that can help the experienced employees.
Thank you.
Hello, my name is Frances Renee Yates. Okay. Hello, my name is Frances Renee Yates. I am a social service clinician too with Protection and Permanency. I have been with the organization for approximately 10 years. I have 5 degrees, 2 licenses, and I have also been an adjunct professor at the University of Louisville Kent School. I have a speech that I would like to read to you, but after looking at you and hearing the things that have been said, I just want you all to meet me where I'm at and who I'm at. And today, wage compression is definitely an issue across the board, along with family support and protection and permanency. For an example, with my experience and expertise, a new worker that is reclassed to my level of a social worker, a social service clinician too, they will be given the entry level of $69,220.56. That is what I make with the years of service that I have, with my experience and my education and the expertise working in multiple levels within DCBS, from a PMP frontline worker up to a clinician who have held almost every position except for FSOS. I've helped develop a couple of programs that's utilized within the community across the Commonwealth. It's very disheartening that we do have workers that do deserve to have those raises. But at the end of the day, with my experience, once this worker gets to the baseline after their 6 months of probation, they'll get a 5% increase, which will make them make more money than I do. And it doesn't take any consideration for the credentials or qualifications that I have. I am here to speak on behalf of not only DCBS and Family Support and PMP. We are Team Kentucky. We are here for our Commonwealth. We crawl out of our beds at any given time of the day, as it is called. We go help our most vulnerable and most precious resources, which is our family and children. The wage compression issue that we have is causing our upper management to have issues that new FSOSs, which are Family Service Office Supervisors for PMP, they will be making at the same level after the 5%, they will be making more than the supervisor who, for example, my FSOS has 10 years experience. She makes $73,747.44. New workers at the tier that was assigned in September, those new FSOSs will come in and start making approximately 10% after all the percentages are given, and she will be making the same amount with no opportunity to get any type of raise. She works multiple hours of overtime that is not even identified because our FSOSs are not even paid overtime. They are expected that they get up in the middle of the night with us to support us and consult with us for our children and our families, and they have to put it as comp. And then they don't have the time to take off because they are supervising. It is my hope that as we are here today that I plead with you all to help develop a fair and equitable paid system for us, including our tenured staff. We have an employee that has 18 years of experience, making $69,220.56. That is the exact same amount of money that I make, and she has 18 years experience compared to my 10 years. She is a very valuable asset to the agency, to our families, and to not only myself, but the new people coming in as we are training and trying to provide the very best of the best for Team Kentucky. That is all of us. That is including our Commonwealth constituents and the people, our families and loved ones, and the people we develop relationships with that come in and trust us to support them. I beg you to listen to us and help us to get fair and equitable wages and to ensure that there's an appropriate tier system in place to address the wage compression. We know that it's not going to be a quick fix to correct the issue. However, if we do not address the current compression issues, including the future compression issues that we're looking at, then our agency is doomed to implode on itself. And the only people who are going to suffer with this is going to be the most valuable resource we have, which is our children and our families. Commonwealth of Kentucky has been Team Kentucky. I continue to say they are our village, and I ask that you all join us and be in our village and help us to support our Team Kentucky, our families, and our children's.
Very good, and I will tell you, we've been working on this fairly feverishly since about June or July of 21, and there are pieces and parts. I just want to take an opportunity. Some of you have contacted me over time. Some of you contacted me recently. We do appreciate what you do. We do understand some of the difficulties. Not all of them. We understand some of them. And I think y'all understand it's a complicated, very complicated situation. That's why we're trying to take care of not just do something, but do something that actually helps.
Absolutely.
Yeah. Next, please.
Can I respond to, I don't remember what you said, on what the personnel cabinet had stated about the salary schedule and bringing new employees in.
If these other two people are good with it, I'm good with it. Okay, you're good.
So he had said something about having them be raised when they come in, giving to be brought up to achieve a certain level. So they're being brought in at midpoint instead of at the minimum. So that would have been one of my suggestions as a solution to help this problem long term. Thank you.
All right. But you are supportive of what they've said so far?
Yes. We knew we had 15 minutes.
Do you have any disagreements with them? All right, very good.
She was actually our data specialist. There's data to support the presentation that's in the packets, and so she was the one that delved into all of the reports and found the data that put that together.
Very good, thank you.
Yes, not the data, or they did all the data, and I am very grateful they did it, and I agree with everything they've said. And then it's just disheartening to still know that there are certain employees within our cabinet have not got that first raise that should have came through last year.
Understood.
And may I add
Sure.
one last thing, sir?
Sure.
We're also losing supervisors because with the compression, a lot of our supervisors are considering stepping down. Because if they step down, they're going to be making more than the supervisor. And we have amazing tenured supervisors that are phenomenal. And if we lose our leadership, we are crumbling our foundation for the Commonwealth, especially for the families and children that are the most vulnerable of our population. And it's very important and very much close to my heart that I speak on behalf of workers who, as they said, have not reached. I have a social service worker one who is a master social worker with 13 years experience who is still a social service worker one. So when they say that these opportunities are available to be moved and reclassed, it's not happening.
Gotcha.
Thank you.
Thank you very much. And I appreciate y'all talking with us and coming into committee and talking with us here also. Anything else?
No.
Oh, I'm sorry. Chairman Daniel.
Sorry. Go ahead.
Thank you, Mr. Chairman. Guys, first of all, a couple quick things here. I'm assuming those document packets are leave-behinds. Is that correct?
Yes.
I'd like to make sure that you give that to the personnel cabinet because I'm assuming there's probably some specificity in there, and I would like their response to what it is specifically you're putting forward and kind of how that falls into the system.
Mm-hmm.
Secondly, I'm interested in what you say because you mentioned the idea that you could make less money by make more money by stepping down as a supervisor, which falls very counter to our understanding of the very extensive review that we had Korn Ferry do on behalf of the Commonwealth. And so I just find that to be interesting. Is there something about that in those documents that you've got there?
Yes. Based on...
With some specific cases that can be looked at, some specific people and such? Okay. I just want to make sure because that's a little bit different than what we had
It has something to do with how the federal government looks at supervisors and people that are able to hire and fire that don't qualify for overtime. And so because of the way our grading system is established, the grade it puts them in, once it put them above a certain income, then it made them not eligible for overtime anymore, even though other employees are still eligible because they're not supervisors and they can't hire and fire.
Yeah, and you'll have to understand, too, that, I mean, obviously there are wage and hour constraints that are beyond the Commonwealth's ability to control. So, all right, very good. Thank you.
I will
Thank you,
say that I myself am a supervisor with 20 years of experience. And if I promote a principal right now, which is 3 grades under me, they would be making about the same as what I would be making. So if I step down to a principal, then I would still be making the same amount of money with a lot less stress and responsibilities.
Very good. I'll just point out that as I asked at the beginning and as I understood, you're all from essentially within the same part of government, the same cabinet that you're dealing with. We've got 5 people from really one cabinet in front of us, and we're talking about payroll that affects 30,000 plus. We have to be careful, or else you're just doing something, wasting money, and the 5 of you still are not going to get any relief, nor will the other 30,000.
Right.
Okay. All right. Anything else? And otherwise, I'll let Secretary step back up if there's anything that she wants to clarify or respond to. Anything else? All right. Thank y'all very much. Secretary Bailey? If there is anything you want to clarify, focus, put a note, or respond to, we'll keep it as tight as we can on the time, but if there's something other, feel free to.
No, I was just, excuse me, just want to say, yes, you had already stated that, it is very complex, and I do very much recognize and appreciate the work that these employees and everyone else does. As all of you all know, I've been here for 28 years. I've been a long-time classified employee and unclassified, so I completely understand. I thank you, Chairman McDaniel, for saying I would like to see this information and be able to respond. Okay, thank you. Yes, because, there's, like I said before, the compensation system is very complex, and there's a lot of nuances that go into this. And so I would just like to be able to clarify any type of misunderstandings and be able to respond.
You are more than welcome to do that on this and any other time.
Okay.
It's one of those issues we all have to work on.
Yes, absolutely.
Right.
Thank you so much.
Thank you very much. So no other questions. We have number 5 on the agenda, property tax on mains, conduits, pipes, and pipelines. We're going to hold this to about 15 minutes, and we still stay on track. And I have possibly Tim Eifler.
Yes, sir.
If you will introduce yourself for the record, and I'll place you under oath, please.
Thank you, Mr. Chairman. My name's Tim Eifler.
Make sure your microphone is on, bright green, and make sure it's close enough to you. Thank you. Perfect.
Thank you, Mr. Chairman. My name's Tim Eifler, and I'm an attorney with Stoll, Keen & Ogden.
Very good. If you'll raise your right hand. Do you swear or affirm to tell the truth, whole truth, and nothing but the truth?
I do.
Okay, I'm going to do a little boxing on this. Property tax on mains, conduits, pipes, and pipelines. We had a potential or possible partial addressing of this recently in response to changes in administrative approaches as well as legal landscape changes on how certain pipelines are taxed. Have at it.
Yes, thank you. I'm here today on behalf of a broad coalition of utility companies in Kentucky that have underground pipelines, and there has been some prior legislation. I'm going to talk about that briefly. But basically, we're asking the legislature to permanently fix a Department of Revenue interpretation of a court case, a recent interpretation, that impacts the classification of pipelines for Kentucky property tax purposes. So in Kentucky, utilities are subject to a special property tax regime. It's what we call the Public Service Company Property Tax, or PSC tax. And unlike the regular property tax, that tax is administered directly by the Kentucky Department of Revenue. And the department has had a regulation that's been in effect since 1938 that classifies pipelines, most pipelines, as real property. And in December 2022, some litigation involving the property tax classification of a crude oil trunk line concluded. And in that litigation, the Kentucky courts basically determined that the line was a trunk line and it wasn't addressed by the classification regulation. Because the regulation didn't apply, the courts applying the common law of Kentucky fixtures classified that specific trunk line as tangible personal property. However, the regulation remains in effect. Despite the regulation, the 86-year-old regulation still being on the books today, and despite the very limited holding of the court in that litigation, the Department of Revenue in early 2023 announced to all utilities that all pipelines, not just trunk lines, would now be classified as personal property for property tax purposes. And why that issue is so significant to the utilities in Kentucky and their ratepayers is that for state property tax purposes, the tax rate that applies to personal property is 4 times higher than the tax rate to real property. So absent that new interpretation being addressed, pipelines are going to be subject to a 4-fold increase in their annual property tax burden. So that new interpretation applied for 2023.
So what would be the harm if the tax went up by 4 times? It's just pipeline companies having to pay it, right?
Well, ultimately, that gets built into rate. So at the end of the day, we're all going to pay for that. It gets passed on to ratepayers. So obviously, the utility companies have a duty to their ratepayers, and that's why we're here today. So the utility companies have protested that assessment for 2023, and they haven't paid the taxes, sitting in administrative review before the Department of Revenue. So earlier this year, we brought the issue to the legislature, and the 2024 regular session passed House Bill 122 in an attempt to put a 2-year moratorium on the change. And there was a technical issue with the timing on that. Basically, the Department of Revenue has interpreted that 2-year change to apply to 2024, 2025, but not the 2023 year that we're all in protest on. So basically, the other piece of that is that legislation that was passed put the moratorium in effect that had no impact on the crude oil trunk line. So the taxpayer who had the litigation was not impacted by that. But as we sit today, we have a 2-year moratorium. It doesn't apply for the first year at issue. The legislature's now had time to look at the issue, so we're back asking that the legislature consider making that fix permanent and have it apply to 2023 as well.
And I think we've gone over drafts of the fix as well as the timing fix. Have you been in contact with, you or anyone else on your behalf, been in contact with industry partners, anybody that's involved in pipelines in the ground, to see if there's any adverse effects that can be identified?
Yes, we've cast a pretty broad net. We've talked to the League of Cities, CAECO, we've talked to COGA, all the industry participants, and no one has any objection with the fix. And keep in mind, we're just asking for status quo ante, basically. We want the classification that's existed since 1938 to continue.
Anybody any questions? Anybody want to dive into the deep underground pipeline taxation issue? Representative McPherson.
So are these pipelines that were considered as real property versus personal property, were they being assessed every year? Was the assessment of the value of that pipeline moving and going forward as they were considered real property?
Yes. Yeah, every year the utilities file a return with the Department of Revenue, and the Department of Revenue values the pipelines, and obviously they increase over time.
Okay. Thank you.
Anyone else? Seeing no questions. Anything else follow up from you? Very good. Thank you very much. You stayed well under time, and I appreciate it.
Thank you.
Thank you very much. Next up, we have number 6, structure of fire departments organized under KRS Chapter 75. We may have Chief Zion Jason Meeman, Pleasure Ridge Park, Chief Stephen Fonte, Ballardsville Fire and Rescue, Deputy Chief Chris Hans, Peewee Valley. If each of you at the table will introduce yourselves for the record, I'll place you under oath.
Yes, sir. Zion Myman.
Stephen Fonte.
Very good.
Chris Hounds.
Very good. If each of you will raise your right hands. Do you swear or affirm to tell the truth, whole truth, and nothing but the truth?
Yes, I do.
Very good. I appreciate y'all coming in. There is a presentation that would have been disseminated. That's a good guidepost, and I'm going to make sure we've got at least 1 or 2 words on this quickly. Small segment of fire departments have a taxing ability or to receive tax revenue.
Correct.
That may not have been adjusted in some time.
Yes, sir.
And I think y'all are ready to talk about that. Is that right?
Yes, sir.
Please proceed. Thank you.
Yes, sir. Thank you very much. On behalf of my colleagues behind me, my name's Zion Myman. I'm representing Kentucky Firefighters Association. I'm the Chapter 75 chairman of that committee, also Fire Chief Pleasure Ridge Park Fire Protection District. We bring before you a proposal to, not necessarily a proposal, but an initiative to increase the tax rate for Chapter 75 fire departments that has not been increased since 1944. So the KRS Chapter 75, again, was created in 1944. At that time, pretty much predominantly volunteer fire departments is what covered this Commonwealth of Kentucky, minus a few paid professional firefighters at that time. The tax rate then was set at 10 cents per $100, and that is for property valuations to include property assessments, tangible taxes, as well as motor vehicles. The purpose of that tax was defraying the expenses of the establishment, maintenance, and operation that the fire departments would have to endure. It's remained unchanged for 80 years, and as many of you have known, the inflation rate from 80 years ago is substantially changed. In 2004, there was an addition of an ambulance service for only some fire departments in this Commonwealth, which gave them the ability to increase the tax rate an additional 10 cents to provide an ambulance service within their community. The Fire Commission, there's other sources of income within the Commonwealth for Chapter 75 fire departments. The Fire Commission does regulate $15,000 for fire departments. There are some stipulations with that includes that fire department receiving the $15,000 has to be at least 51% volunteer on an annual basis, and as well as in cities of all classes. The Kentucky Fire Commission also allows $4,429 on an annual basis that is filtered through the fire departments for full-time career firefighters. And there is stipulations that allow that $4,429 to include a number of training hours as well as being a full paid firefighter. Those funds are brought to the firefighters through the Firefighters Foundation program, which is funded through insurance surcharge. These funds are based on entities meeting the criteria set by the State Fire Commission. What are some other revenues of income from fire service that we're having to deal with today? Fish fries, bingos, those type of things are in the rural communities, and those are the things we're trying to overcome at this time. The 10 cents per $100 tax in 1944 was based on the economy at that time and was probably sufficient for the cost of for the operation. Looking at the rate of inflation over the past 80 years, you can imagine what it would be. But 10 cents per $100 in 1944 equates to around $1.79 in 2024. And this was assessed on the federal inflation rate calculator. And you can see the cumulative rate of inflation is over 1,687%. What's our cost of doing business? Just a few things to point out. In 1944, the cost of a fire apparatus was $8,083. An 85-foot ladder truck, was $18,250. Whereas today, these prices are just produced. 2024 Pearson Forcer, $1,018,000. And then there's a Seagrave Apollo 100-foot ladder truck that has a platform on it for $2,235,000. So the fire apparatus that you see going up and down the road are at a huge value that a lot of fire departments are trying to make ends meet just to be able to provide what is out there as far as the National Fire Protection Association guideline of fire apparatus being on the streets for a certain amount of years. Cost of doing business. How much do you think it costs to outfit a firefighter? Back in 1944, it cost around $50 to $70. It's almost over $20,000 today. A helmet costs $350 all the way down to a thermal imaging camera, $4,300. The SCBAs that we wear on our back, $6,300 for just one. So you can see the cost of what it costs of doing business. Every year, new things are coming out to say a firefighter has to have X, Y, Z, and we're having to endure those costs. And it could be cancer hoods. Cancer hoods prevent us from getting toxins around our neck. It could be a different type of a boot, whatever the case may be. There's new NFPA guidelines, new OSHA standards that are coming out every year to say you have to do this. Cost of doing business. We all know the cost. You all see them in your households. Insurance is going up. Gas prices are going up. Your utility bills are going up. Building maintenance. How much did wood cost prior to COVID? Okay, it's gone up tremendously. We're now having to conduct fit-for-service annual physicals for all of our firefighters. When I first came into the fire service, I'll never forget, back in 1994, the way I found out that we were getting a fire run was a siren that was outside. It was also used for civil disturbance or any type of weather issues. We have to use pagers. We have to use radios. We have to use digital trunking systems. There's all those type of things out there that we have to use nowadays that cost money. Equipment for apparatus are required by the NFPA standards, like I said earlier. There's different size hoses that have to meet the demands for the type of fires that we're fighting nowadays. When I first came in, furniture was made by horsehair. Now what is it made out of? Synthetics, chemicals, you name it. We're having to adjust based on the strains that we're having in society today. Additional training. You can read these additional trainings: incident management training, medical training, hazardous materials, search and rescue, vehicle rescue. When I came in the fire service over 29 years ago, I did not think that I was going to teach 530 firefighters in my fire department how to go into an active aggressor incident. You can imagine the eyeballs that I got, okay? But when you send people into those type of atmospheres, you've got to properly equip them, you've got to properly train them, and those are things that were not set in 1944 for us to have any type of monies to be able to do. A huge issue now is the number of volunteer firefighters versus the call volume. There's over 280,000 difference of calls from 1984 to 2020. The calls are increasing, but as you can see, the number of volunteers are doing what? Decreasing. The number of volunteers has decreased by 24%, given the run volume of where it is now of 2020. And all these statistics came from the National Volunteer Fire Council. Aging profile. What do people not want to do anymore? And as much as I hate to say it, as I started out as a volunteer, I also rose through the ranks in a combination fire department as well as a career fire department. The age of volunteers nowadays is decreasing. The age of volunteers joining the departments is decreasing. The age of the volunteer firefighters is increasing. An average of 40 years old is the average age of a volunteer firefighter. And I can say this to myself, as I'm an aging volunteer as well as an aging career firefighter, I'd much rather have a younger person going into some of these atmospheres than I would myself. And it is just what it is. It's the age of the volunteers. It's also the time we're in. It's also where society as a whole just does not want to do what? They just do not want to volunteer, as unfortunate as it is. Cost savings in volunteer fire service. Over 29,452 fire departments are in the United States that are volunteer. 5,300 are mostly volunteer, 2,459 are mostly career, and 2,785 are full career departments. The time donated by a volunteer firefighter has equated to almost $49 billion a year, and there's over 767 fire departments in the Commonwealth, and of these, 127 are Chapter 75 fire taxing districts, and that's who is affected by this tax rate at this time. So in summary, the cost of operations has gone up exponentially. Recruitment, retention is a major issue. Training demands on increasing call volume. Employers are less likely to let personnel off to make runs. There's more demands for specialized training. Lack of funding over the years has caused what? Firefighters are who? Firefighters are who you call when you're at your worst. We're the who. We're the jack of all trades. And if you need an electrician, you can call a firefighter. If you need a plumber, you can call a firefighter. The time is now for us to properly and adequately fund these fire departments in the Commonwealth of Kentucky. There is a domino effect of a Chapter 75 fire department closing its doors. That will lead over to other fire departments in Chapter 95 and the other fire departments who might be prescription fire departments throughout the Commonwealth. So the time is now. Our initiative is to increase the tax rate for Chapter 75 fire departments, which will make it a safer environment for everyone.
I'm not taking a position, but I did want you to be here. But I do want to follow up on one thing you said. One of the Chapter 75 folds somebody else has to pick up if there is no fire department that can legitimately cover an area, there is a physical impact to the residents in that area. And I just want you to hit that real fast.
Yes, sir. So I board a Chapter 95 fire department personally. And if I close my doors for whatever reason in any one of my firehouses, that is going to that there has to be coverage there somewhere. There's mutual aid agreements throughout the Commonwealth. There's automatic aid agreements throughout the Commonwealth. And in Jefferson County, there is an automatic aid agreement within a certain boundary for the city of Louisville, which is a Chapter 95 fire department, and Pleasant Ridge Park, which is a Chapter 75 fire department. If there's not a firehouse if there's a fire within those certain boundaries, a Chapter 95 fire department will have to come into a Chapter 75 fire department, which reduces the coverage for that Chapter 75 fire department.
And insurance companies seem to change their rates on your
Yes, sir.
homeowner insurance depending on what type of coverage you have.
Yes, sir. So legislation last year passed a law that stated that if there is a change in a reduction of the services provided by any fire department in the Commonwealth, there has to be a notice done. And I feel that notice is going to be coming to you all in a larger fashion. There has to be a 30 days notice, so you're aware of that was passed last year.
Yeah, very good. Very good. Chairman McDaniel?
Thank you, Mr. Chairman. Guys, a couple of quick things. You say you're here seeking an increase in the tax rate.
Yes, sir.
Now, we don't actually set the tax rate, though, correct? Isn't there a board that governs the Chapter 75 department that actually would set it? We would just put the authorization in place?
That's correct. Currently, the KRS has a cap at 10 cents.
Right.
What we're looking for is to have the cap increased because right now, most of the Chapter 75 fire departments are at a cap, and we have no ability to increase our revenue.
And are you guys subject to the provisions of, I believe it was House Bill 440, which allowed for compensating plus 4 each year?
We are at the cap. If you're at the cap, then we are not. So if we're at 10 cents, which most of us are, we have no ability to go up.
To raise your rate, you don't, but you can still collect more dollars.
Yes,
for
sir.
example,
Yes, sir.
And I can really see where there would be almost two extremes, right? If you've got an area where the property valuations have skyrocketed, the collections would naturally, if you were at your 10, your collections would go way up. But to the same end, if you've got one with declining property values, your collections would go down.
Yes, sir. That's correct.
You're dealing with that, yes, sir. But you're also dealing with, and I'm just going to use my department as an example, there's a fiduciary responsibility for the fire chief as well as the Board of Trustees to say, do we have to even increase? We could say that we're going to increase this cap, and at Pleasant Ridge Park currently, I would not have to. That's good for me, but I can look at either one of these gentlemen next to me, and they're going to say, we have to do this now. And why I say that is because we are an all-paid fire department. We are not a combination department anymore. But what has fortunately happened at Pleasant Ridge Park is, yes, the property values have increased. That's good. But what also decreased at the same time? Pension costs. So when I first came into Pleasant Ridge Park, our pension cost was 49%. It has dropped down to 38%. So there's an offset there. So I can say from a fiduciary responsibility for myself, I would not have to take advantage of this tax increase currently. If something does change, it at least gives me the ability to make sure that I have livelihoods for the people that I employ.
But understood. But so let's say, for example, you're at your 10% now,
yes, sir.
Right? And just for argument's sake, you're taking in $1 million.
Yes, sir.
Property values go up to the point that you're taking in $1.1 million. So you're taking an extra 10% a year.
Yes, sir.
You would then have to reduce your rate from the 10 cents so that you didn't take more than the comp plus 4. Correct?
Yes, sir. Yeah. Yes, sir. It's not saying that I would have to. It gives me the ability to do that. There could be, as one of the things in the slide that I failed to mention, especially with the apparatus, is we've just been told that a new apparatus, there's going to be an additional 15% added on to the vehicle cost of a fire apparatus.
Right. But let me get back. Let me get as focused on the question though,
okay.
which is, you either are or aren't governed under the statute that allows for compensating plus 4.
Yes, sir.
Under the example I gave you, if you had a 10% increase, your rate would necessarily have to come down or be subject to a recall.
Correct.
So
Correct.
Are you subject to that statute?
Yes, sir. Yes, sir.
You are. Okay, very good.
I don't know. We aren't subject to that. We're
We're
capped.
We're not subject to that recall.
We're not-
I apologize. I misunderstood your question.
Okay.
We're set at a cap. It's the 7-member board that sets the actual tax rate annually, and they look at the budget, and then they're the ones that make the decision as to whether or not we're going to do, as an example, 9 cents or 9 cents and 9.5 cents or whatever. But they cannot go over that 10-cent cap. Correct.
All right. Thank you.
Is there anyone else? I'm sorry. Representative Hart?
Thank you, Mr. Chairman. Could you all explain to the committee how the makeup or how the board is comprised? Because there is some differences with the Chapter 75 as compared to some of the other, like mental health and library boards that deal with tax rates. I think it would help the committee to understand how you all are appointed and elected.
So we have 2 firefighter representatives that are elected by the fire department. Three appointed from county government, and then 2 property owners. Two property owners, yes, sir, in the district.
And the property owners, they are elected by the people that live in the district, correct?
Correct. There's a what's the word?
There's an election.
Election. Thank you. Sorry, an election held at the firehouse, in where the nominations are at the station for that.
All right. Thank you.
Thank you. Anyone else? Thank you. Thank you for what you do, and thank you for coming in and putting some focus on the issue today. Appreciate it. Thank you. Next up, we have item number 7, Volunteers of America. I may or may not have Jennifer Hancock, which I think I see in the room, and Jared Koski, maybe. And I believe there is a presentation also, but if the 2 of you will introduce yourselves for the record, make sure your mics are lit up green and close enough to you.
Good afternoon, Chairman and members of the committee. Jennifer Hancock, President and CEO, Volunteers of America Mid-States.
Good afternoon. My name is Jared Koski, Director of Data Analytics.
Very good.
For IP Secure Tech.
Very good. Each of you raise your right hands. Do you swear or affirm to tell the truth, whole truth, and nothing but the truth?
I do.
Thank you. Please proceed. This is VOA.
That is correct.
Have it.
Do we have some slides that somebody's going to pull up for us? Or am I supposed to pull them up here? I didn't bring my glasses. Today, we are here to brief you on the return that we are realizing on the investment that you all have made in our Freedom House program. And I literally can't see this, Jared, so can you make it full view for me? I do need glasses. So thank you for your investment in Freedom House. We want to talk to you about this whole family solution and what we are realizing in preliminary data of a 5-year longitudinal study that we embarked on about 18 to 20 months ago. First is just a quick level set. Many of you have toured Freedom House, which we're grateful for. If you haven't yet, we invite you to come out either in Manchester and Louisville. This is the only program of its kind in the region because it's unique in the fact that we enable mom to bring all of her kids into treatment. This is a full family-focused service that treats every age, every developmental stage for the family. We focus as our priority on women who are pregnant, and we focus on allowing them to have access to high-risk prenatal health care with the goal of delivering a healthy baby that has no days in a NICU. We rely on data and evidence. This is not a program that can rely on an ad hoc approach to doing what is intuitive. We do what the data suggests is most effective in disrupting intergenerational cycles of family trauma and family substance use disorder. We have delivered 343 babies. Now that we've been around for now more than 30 years, but back when we started, we did not have reliable electronic health records. So this is the data that we have that is most current and most accurate based on our electronic health record system. I mentioned that we have programs today in both Louisville and Manchester. The Manchester program opened the first month that the pandemic descended, and despite that challenge, we were fully staffed and fully at capacity almost immediately, to the point that we are now in the process of doubling the size of that program and adding locations in Owensboro in northern Kentucky and Stanford so that we can be regionally accessible to every family who needs us. You heard me mention our access to high-risk prenatal health care services. That is absolutely key for these mothers to be able to deliver a healthy baby. Clearly, we want to get mom into treatment as early in the stage of her pregnancy as possible. We focus on health and nutrition. We provide licensed medical services. That's psychiatry, that is a medical director, that is OB services, as well as clinical therapy services. In addition to that, we believe in the value of lived experience, and so we hire people that have been served by Volunteers of America that now have a credential as a peer support. We provide parenting classes. We work closely with DCBS. They are our key partner in this work to provide safe, supervised visitation for those families who have had a disruption in their parenting. And then I mentioned trauma. We believe at digging at the root cause. This is not a superficial process. This is a full-time job for a new mom who's coming into treatment. 40 hours a week of clinical programming. And then we provide ongoing case management and aftercare services. So this is really where the rubber meets the road. And I'm going to turn it over to Jared in just a moment so that he can show you some of the preliminary findings. We know that NICU stays in Kentucky are quite expensive. Any of our MCOs will tell you that this is one of the key metrics that they monitor. We have, on average, 18 days length of stay for those infants who were born substance exposed. And that is compared to our length of stay, and that's for our mothers who come to Freedom House who deliver a baby from our program. Our average length of stay in Louisville is 2 days. Our average length of stay in Manchester is 5. We attribute that higher length of stay in Manchester, frankly, because we are still getting many moms who are coming to us in that third trimester, or worse, being referred to us at moment of delivery, and then it's too late to intervene. And so we are experiencing a higher rate of NICU stays, but the net total average is 3.5. That is allowing us to avoid $20,000 per infant that we're able to assist mom in delivering. We also measure a variety of additional metrics associated with health and wellness. One of them is APGAR scores. 92% of all of our babies have a healthy APGAR score at delivery. I want to get to Jared, and I know we're crunched on time today, so I'm going to cut to the chase a little bit more and tell you that one of the key reasons why we're here today is because we've heard from many of you the questions around behavioral health spending as it relates to Medicaid, and what is the return on investment. And we also know that there's been a lot of attention paid to outputs, where we're celebrating the number of treatment beds that we have in Kentucky. And we believe it's important to turn the conversation to what are the outcomes? What is the return that we're getting for those healthcare activities for a vulnerable population of Kentuckians who need treatment for substance use disorder? 2 years ago, we reached out to all the Medicaid managed care organizations and ask them to engage with us on value-based contracting. That is, that we want to be rewarded for the quality metrics that we're able to produce. 5 of the 6 have signed value-based contracting contracts with Volunteers of America. We are realizing payments for healthy babies, for graduating women from treatment who have stable housing and living wage incomes. And you're going to hear more about that data that we're using to demonstrate not only point in time real returns, both socially for that family that's being preserved, that's graduating into a stable environment where we're staying with them and watching them sustain in long-term recovery, but there is real economic return on investment. This is something that is absolutely scalable. In 2023, we partnered with the Humana Foundation and an anonymous donor who came forward and made an $800,000 investment. Humana made a $500,000 investment into a $1.3 million longitudinal study, the first of its kind. We are the only provider that we know of that asked for external evaluators to come in under our hood and inspect the impact of our work. It's one thing for us to tell you that we're measuring our results. We do have a quality assurance division inside of our organization. It's another thing for us to have somebody who's a very smart strategic data analyst like Jared Koski come in and objectively review the results that we're getting. This is a study that will continue to reveal that we are on the right path, and again, a scalable solution that can realize significant cost savings for the entire Commonwealth. And with that, Jared, if you don't mind to tell them a little bit about your background and how you came to us, and then we'll run through some of the initial findings.
Certainly. I was contacted by VOA to do the data analytics for this study. My background, I got into data analytics while I was in the military. Led sniper teams, sniper sections, dove heavily into intelligence, and came up with human pattern analytics, which raised our capture rate from 35% to over 90% in 2008, 2009 in Solder City. Upon retiring from the Army, I went back to school, studied environmental science, geographic information systems. My first job out was doing data analytics for expert witness testimony in the opioid trials against Purdue. From there, I've held various positions at different consulting firms, as well as vice president of data analytics for a company called Velocity, director of data analytics for IP Securitech, and vice president of operations for a company called A4D. So this program's been going on for about 2 years. It's a rolling intake, and it's a self-reporting survey. So right now, initially, we have 295 participants, those participants have 723 children. The 6-month survey participation rate is just right over 67%, and the 1-year survey participation rate is 68%. In order to roll this up, I had to have participants that were in both the initial, the 6-month, and the 1 year, so which gives us a sample size of 62 participants. So one thing we looked at was participants who were arrested 30 days prior to the survey. You could go back one.
Okay.
And participants arrested 30 days prior to their survey. Initially, participants that just came into treatment, 19 of the 62 had been arrested 30 days prior to treatment. That dropped to 1 and 1 at 6 months and 1 year. Substance abuse since the last survey, that was 30 days prior to their initial survey. 47 out of 62 had been actively using a substance. It dropped to 9 at 6 months, and at 1 year, we were at 10. Now, this is where we actually see the social return on investment. I think that we can all agree that if a mother's doing better, the children are more than likely doing better as well. And participants with an annual income of $10,000 or less, initially coming in, it was 54 out of 62, which is over 85% of the participants. At 6 months, it was 52. At 1 year, it was at 36. Participants' source of income is wages and salaries. We see that rising. So initially, there's only 6 that their major source of income was from wages or salary. At 6 months, it was 19. At 1 year, we're at 27. So what we see is mothers going out, getting jobs, becoming more stable and more self-sufficient. Participants attending college, attaining a GED, or pursuing a professional certificate. Initially, we had none out of those 62. 11 at 6 months, 13 at 1 year. And we're seeing a drop on the utilization of Medicaid. So initially, it was 54 out of 62, dropped down to 48, then 46. And I believe that's to mothers actually getting a second lease on life, starting a new job, and coming out of that lowest wage period and moving up. And finally, newborns born with a significant NICU, which is 15 days or more. Interestingly enough, there's 21 children born within 6 months of their initial survey and 21 born while they were in treatment. Out of the 21 that were born 6 months prior to coming into Freedom House, 8 had a significant NICU stay, which is 15 days or more. If they entered treatment, for the 21 that were born, only 2 had a significant NICU stay. Now, all this is just preliminary data. We're still collecting more. The study will be going on for another 3 years. But so far, I believe that the findings are promising.
Real quick, the 2 grants that you mentioned up front, will that be able to sustain the data analysis for the next 2 or 3 years? Is that what that's coming from?
That's right. It fully pays for the 5-year study.
Thank you.
I also want to mention the Kentucky Association of Health Plans has been a key partner. They also recognize the importance of measuring outcomes over outputs or even activities. We are engaged in another project with them that is closing the racial disparity gap around Black women who are dying postpartum disproportionately from white moms. And so we are engaged in a study called Access Justice and look forward to coming back with some data and findings around how we are going to work together to ensure that Black Kentuckians access treatment, particularly Freedom House. So my overall message today is one that is very data focused. Jared is one of 2 evaluators on this project. He has a counterpart at the University of South Florida, Dr. Carrie Riggs, who is a PhD program evaluator, who's also supporting this project and measuring the social return on investment. While the data is preliminary, it is enough of a healthy sample size that we can extrapolate and anticipate that over the life cycle of this project, we will have a robust data set that will validate to you that the investment that you're making in ensuring this is regionally accessible is not only successful in keeping Kentucky families together, getting them back into the workforce, getting them into stable housing, but realizing a cost savings along the way.
Very good. Thank y'all. Senator Gibbons.
Very briefly, thank you, Mr. Chairman. One of your earlier slides, Jennifer, indicated cost savings, approximate cost savings due to the shorter stay in the NICU. What was that number again?
Approximately $20,000 per infant delivered.
And what percentage, you may not know this, but you're savvy enough, you may well know it. What percentage of your deliveries at the time of delivery, the family is a Medicaid family?
Almost 100%.
Okay. The savings is going to the MCOs, which I hope drives the book of business that drives the cost down for the Commonwealth.
That's right.
Am I missing anything in the steps there?
No, you've got that right, sir. And what we're doing is we are sharing on the backside. So they are reimbursing us through that value-based contract for every healthy baby. We are receiving a bonus payment.
Great.
As essentially to thank us for ensuring that mom was able to deliver successfully.
Great. And are you in conversation with the cabinet? The cabinet knows the results of this work, and the cabinet is ready to go to work when it's time to renegotiate these contracts?
I have absolutely communicated with Secretary Friedlander. He was a key proponent of engaging the MCOs and encouraging their participation in contracting with us. To our knowledge, we are the only behavioral health provider in this space that is working with the MCOs and the cabinet under these value-based contracts.
Great. Thank you.
Thank you.
Thank you. Quick follow-up on that. I just want to make sure I heard this correctly. It is possible in the healthcare space and even in Medicaid to make sure it is value-based contracting on outcomes, not provisioning of services alone.
Absolutely.
Value-based contracting based on outcome performance, correct?
And if I may say, Chairman, why this is critically important for a provider like Volunteers of America that is a not-for-profit. It is important for us to get rewarded to incentivize quality over quantity. Unfortunately, we have seen the pendulum swing towards quantity and providers being reinforced because they're getting paid fee for service. The bigger you build, the more revenue you can extract from Medicaid. And how do we know if that's working? This study will demonstrate what is capable for the Commonwealth. And so absolutely, value-based contracting is possible in the Medicaid space. And thanks to the 5 MCOs, all but United Healthcare, and to United Healthcare's credit, they just don't have the market share for it to make sense for them yet, but they are ready to go with us as soon as the market demands that.
Very good. Thank you. Senator Boswell?
Thank you. You mentioned Owensboro, so I'm interested. I think you have a location there that you have picked out and you're looking at that. I just want to ask you a couple. You mentioned that you're the only provider of this type of treatment. Is that correct?
Yes, sir. And by that I mean we are the only provider that does not limit the ages or numbers of children that mom can bring into treatment with her.
So currently, right now, in Owensboro, since we're talking about Owensboro, what's happening to these families right now? I think there are some other people maybe they're doing, maybe not specifically what you're talking about, but I just want to make sure that the current, if there are people that are providing their services now, that this is not displacing those. And so what's happening right now to the families in Owensboro that you will be helping? What's happening today to those families?
Yes, sir. They're being transported to Jefferson County's Freedom House program. We work closely with Owensboro Health and your local DCBS office. We have a partnership with DCBS there. We're providing services in the community. We have an advisory council that's very active there. And so we're providing transportation. We believe it's important for families to be served as close to home as possible because part of that aftercare is helping them find stable housing and education and workforce opportunities. That's why we're eager to come to Owensboro, and soon will be under construction. Thank you.
Anyone else? Representative Fleming.
Thank you, Mr. Chairman. Ms. Hancock, obviously I'm a big fan of what y'all do, and thank y'all do a wonderful job, and I do appreciate you told me some time ago about their endeavor on doing this. And I was really anxious to see how this could be applied to other agencies and so forth. Can you comment, or Jared, can you comment on other states that have this type of structure when it comes to value-based contracting that's looked at outcome input and how you can benchmark your process, if at all, with other programs in the country?
I would be happy to, but I really do not know of any other programs that are doing this.
That made it easy. Okay.
Any further questions?
We can be pioneers.
Does that cover it, Representative Fleming? Yes, sir. All right. Anyone else? So no other questions. Thank you both for presenting good issues. Thank you.
Thank you for your time today.
Thank you. And I will simply note on the agenda, and it is not giving short shrift to it, correspondence received, reports received. Please review. Ask anyone on staff if you've got questions about that. And we have, if I recall correctly, and Chairman McDaniel, please correct me, we have an exciting November the 6th meeting coming up. Same place, same channel. We are adjourned.